All right. This week we're looking at the respiratory system for histology. And to understand the respiratory system, we can divide it into two separate kind of sections, the conducting passages and respiratory passages. Our conducting passages are the areas in the respiratory system that air is flowing through. They're directing air towards our respiratory passages, essentially. So that'd be our nasal cavity, our pharynx, our trachea, our bronchi, and our bronchioles. And they're involved with conducting or moving the air, filtering the air, humidifying, and warming the air. They're also involved with speech and sense of smell. Our respiratory passages are primarily where we have gas exchange, and that would be our alveoli. Looking at the nasal cavity, we can see kind of some general anatomical structures. When we are moving through the nasal cavity, we have this olfactory bulb that we can look at. And the olfactory bulb is where we have the nerve stimulation that's occurring in this nasal cavity, where you'll have olfactory cilia and mucus. These dendrites are olfactory receptors. The axons then moving up and synapsing then with our olfactory nerve, which is a cranial nerve. When we look at the olfactory epithelium, we can see it here, and it actually looks kind of similar to our pseudostratified columnar epithelium with cilia on it present. So if we look at our olfactory glands, we have Bowman's glands present. We also have supporting cells. These secrete odorant binding protein, and our olfactory receptor cells bind odorants that are bound to these old odorant binding proteins. Moving downward, most of our conducting pathways are lined by respiratory epithelium, which would be pseudostratified columnar epithelium that's ciliated, as we can see here, with goblet cells secreting mucus. Mucus will then trap dirt and bacteria, and cilia will move together in a wave-like motion to move that mucus up towards the pharynx. We have basal stem cells that can regenerate this epithelium. Our conducting passages or pathways have three histologically distinct segments: the trachea, bronchi, and terminal bronchioles. The bronchi, if you are referring to it as a singular component, we call this a singular bronchus, and it has lobar and segmental branches. Looking at our respiratory passages further, there's two histologically distinguished segments, respiratory bronchioles and alveoli. And alveoli in singular terms is an alveolus, and it contains ducts and sacs. Looking back then even further, we can see that there are several different layers of this tracheal wall. The tracheal wall is unique in that it mimics the gut, the GI tract, and it's interesting that it does so in that the esophagus and the trachea have a similar embryologic origin, and they are tube-shaped origins, or tube-shaped organs. And we can see that they start here in the fourth week kind of together, and then they branch off and differentiate. And by the end of 4 weeks, the trachea has its own bronchial buds and continues to develop into our kind of premature lung structure by the end of 8 weeks. Our tracheal wall then has several distinct layers, a mucosal layer, which includes the epithelium, and this lines the lumen, as well as the lamina propria, a little layer of connective tissue. The submucosal layer, which is loose connective tissue with some elastic fibers, and then adventitia, which is dense, irregular connective tissue and can withstand strain and strain from multiple different directions. Our trachea also contains these kind of purple rings, and we can see this here looking almost like a horseshoe. And this is hyaline cartilage that's located within our trachea, and this prevents collapse or closure of the tracheal lumen during expiration. It's horseshoe shaped, and you can actually palpate it and assess this if you push down. No one likes their neck palpated, but if you push down kind of below your thyroid cartilage, you can actually feel some of those tracheal hyaline cartilage rings, and the cartilage opens in the back towards the esophagus. In your trachea, you also have a trachealis muscle, which is smooth muscle, and it joins the two ends of the cartilage rings in the posterior segment next to the esophagus and allows for some expansion and some contraction to move things along. Our bronchi, or one would be bronchus, are we can see them here in this picture. It has this kind of histologic, almost misshapenness to it. Extrapulmonary bronchi are also histologically identical to the trachea. Our terminal bronchioles, when we start to talk about the respiratory system, you'll see that we have a primary bronchi, which will have the trachea, primary bronchi, which is right and left. We'll have secondary bronchi, and we'll have tertiary bronchi. From there, we move to bronchioles. And bronchioles are very simplistic structures lined by just simple cuboidal epithelium, as we can see here. They also have club cells. These club cells produce a surfactant-like substance as well as some cilia that helps to move fluids throughout. As we get to from terminal bronchioles to respiratory bronchioles, we actually transition over to our respiratory system instead of our conducting system. And the bronchial wall will become really so thin that it starts to kind of balloon out. And these ballooning outs are the alveoli. And this is where we start to see gas exchange in the respiratory system. Our alveoli or alveolar ducts or sacs almost kind of look like fat cells, but slightly different than fat cells as they're lined with, more cellular structure than potentially a fat cell is. But our alveolar ducts and sacs will transition to thinner and thinner walls. These walls lack smooth muscle, and they're lined with just a simple squamous epithelium. These would be alveoli here. This is a duct. These red structures are going to be blood vessels. This is the lumen of a bronchiole. And then over here, this whole structure would be an alveolar sac. An alveoli is plural and alveolus is one. Our alveolar epithelium is specialized, simple squamous epithelium containing type 1 pneumocytes. And then there are also these secretory cells, which are cuboidal cells, which are type 2 pneumocytes. And type 2 pneumocytes have lamellar bodies that secrete surfactant. And surfactant is a protein fat complex or protein lipid complex that forms a thin film reducing surface tension at this air fluid interface, and it prevents alveoli, these little bubbles, from collapsing in on themselves. They can regenerate to replace type 1 pneumocytes. So this is what alveoli look like. You can see our alveolar septum here, and our alveolar septum is just type 1 pneumocytes as well as endothelial cells from forming our air-blood barrier. So we can kind of see this packed between the two. The air-blood barrier is present too because during gas exchange between alveoli and capillaries, oxygen and carbon dioxide will cross the air-blood barrier, and it requires surfactant, type 1 pneumocytes, our double basement membrane, and endothelial cells. Alveolar dust cells are macrophages and they phagocytose inhaled particles as well as antigens that are trapped in mucus and or surfactant. These are constantly moving up the bronchial tree in mucus that's transported by ciliary action, and we either dispose of them by swallowing or by coughing them out, expectoration. This is a study site that you can go through and label the areas of the trachea, for instance. We have the mucosa at the beginning, then we have the submucosa, hyaline cartilage, smooth muscle, and adventitia. You can look at the bronchi, they're surrounded by lung tissue, and you can fill in kind of the rest of these blanks to help you study. That's the end of our rapid fire histology lecture this week. The main goal is really understanding these structures because we aren't going to get to function of the respiratory system until winter term. So really the structure, the different epithelial linings and layers is all that you need.